Hello, my name is Janai Moorhead, and I'll be your instructor today. I'm with Foundation Consultants. Today, we'll be doing an overview of the Medi-Cal transformation in the state of California, and we'll be concentrating on community supports, trainings, and resources. We'll be understanding the big picture, and we'll be understanding how to build the knowledge and capacity to contract with a managed care plan and deliver services as a community-based organization. These resources will advance your ability to provide community supports to your community by understanding the services that Medi-Cal offers with the Department of Health. Our topics of discussion will be the goals of Medi-Cal transformation in California, the 14 community supports, the key enhanced care management and community supports policies. We'll be looking at the webinars and trainings related to key enhanced care management and community supports policies. And we'll be also looking at the webinars and meetings in the area of strategic planning for the 10 areas that need Medi-Cal transformation. In this lesson, the goal is to build the knowledge and capacity to contract with a managed care plan. And of course, as I said previously, that this will advance our ability to provide community services in your community by understanding the services Medi-Cal offers. So in understanding the new transitions that the state of California, the Department of Health has undertaken, I have prepared the following materials for you to review and use as a resource. And if you are watching this and you're not in the state of California, then it is good to watch because these are transformations that are coming to your state. It is sweeping the nation, and California is doing a 5-year test plan. And we're pretty much into our second year of this transformation. So in this lesson may be in its form that you see now, or it may be on a learning management system. But for this particular lesson, the first portion will be this video. And then the second one is the goals of Medi-Cal transformation. We'll show you the 14 community supports. And then we will review the key enhanced care management and community supports policy. And I will not be covering enhanced care management in this lesson, but excuse me, just for the sake of understanding enhanced care management is care coordination. And then we'll be talking about webinars and trainings related to current community supports and enhanced care management topics. And then also webinars and meetings in the areas of planning and strategy of the top 10 initiatives of Medi-Cal transformation. So we'll start with our first one, which is the overall goals in the state of California for Medi-Cal transformation. And of course, when something this big is undertaken, then there is a lot of learning, a lot of changing, a lot of things that we have to have an open mind on. So the first thing is to address California's physical and mental health needs. We want to improve and integrate care for Californians. And because this is a test project and may come to your state, then you can substitute your state name right in there. And also, we want to be a catalyst for equity and justice. And we want to work together to build a healthier state. And then to stay informed, you can also, when you go on this website, you can also subscribe to the Department of Healthcare stakeholder email newsletter. The next thing that's important is to understand what community supports are, and I'll briefly go over the 14 areas of Medi-Cal community supports. And again, I mentioned that this involves CBOs, nonprofits, and now it is possible for nonprofits to continue what they're doing, but now be a part of the healthcare system and also obtain fee-based services or get paid a fee for the services that they now are doing. So this is a shift from the grant, what I call the grant culture or the grant mentality. Grants are wonderful, but sometimes they come and sometimes they go. But this is an opportunity now for nonprofits to do what they're doing, but then tap into the Medi-Cal system and to work with managed care plans to deliver services. So the 14 community supports are housing transition and navigation services, housing deposits, and housing tenancy and sustaining services, and short-term post-hospitalization. Let me stop there and say that these are the 4 services that are the most common, and they are being delivered by many of you right now. You're sitting at your desk, or you're going to work, and you're going to provide um, services to homeless people, homeless families, or homeless people experiencing, or rather at risk, rather. Okay, housing deposits and housing tenancy sustaining services, and many of you have shelters, and now you can seek to transform those beds into short-term post-hospitalization housing. And then we get further into recuperative care, respite services, day habilitation services, nursing facility transitions. These are people who have been in the nursing facilities, but now they are transitioning out to their homes, and they need more services. Or perhaps they it looks like they are going into a nursing facility, but then you are helping them and giving them diversion to assisted living facilities. There's community transition services from a nursing facility transition to home. There's personal care and homemaker services, environmental accessibility, home modifications. And for you people who do food banks, this is your area for medically supported food or medically tailored meals, where the members of healthcare plans now receive deliveries of nutritious prepared meals and healthy groceries to support their health needs. And then also sobering centers, and then asthma remediation. So if you find that you are doing a service here and that you're already doing it, then you may want to tap into the programs um, on the Department of Health Care website. The second resource I wanted to explain is key enhanced care management and community supports policy guidance. I will not go over it all, but this page goes back to 2021. It starts from the bottom up, and then at the top is the most recent policy guidance. And these are things that are changing. So at the bottom, when the community supports and ECM, enhanced care management, started, um, they had policy, but then as things change, as people weighed in on some of the things that were needed or needed to be taken off, need to be added, then the policy guidance is ever changing. So this resource here starts with the most recent policy updates at the top, again for enhanced care management and community supports for Medi-Cal transformation. And then the last one is the webinars and meetings for the 10 areas that needed changing in the state of California. And here, of course, the Behavioral Health Initiative, Community Supports, which I'm talking about now, a Dental Initiative, they're all very important, Enhanced Care Management, the Incentive Pay Program, which incentivizes managed care programs now to do all this work and then work with community-based organizations. Integrated care for dual eligible members. Sometimes members of health plans are dually enrolled in several programs, and now the whole point is to streamline that process. There is a community that just serves the justice involved, and so that is specifically for people who are in prisons and now coming out into the area of the workforce and getting acclimated to everyday life. And now they need medical care also. That is a separate population that needs care, population health management, and then also providing access and transforming health, statewide managed long-term care, and then supporting health and opportunity for children and families. So these are all very important changes, and there has been extra funding um, under the CalAIM, CALAIM, CalAIM initiative, and they also have funding and technical assistance, and that's where you can find me at the Path-Cited, 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 and there you will find me giving technical assistance, and I'm happy to help you. Thank you very much, and this is the end of this lesson, and we'll see you in future lessons.